Hello again, this is Earl Silverman, Editor-in-Chief of the Journal of Rheumatology, welcoming you to my first interview of 2022, and I hope this turns out to be a easier and better and healthier year than 2021. Today I'm interviewing and highlighting a paper of particular interest to the readership that will be published in the January 2022 edition of the Journal of Rheumatology. The article I have picked for this more in-depth exposure is entitled COVID-19 in Pregnant Women with Rheumatic Disease, Data from the COVID-19 Global Rheumatology Alliance, and is by Dr. Bonnie Bermas and colleagues from the COVID-19 Global Rheumatology Alliance. The paper is now available on the journal's website at jrheum.org for viewing, as is an editorial with an overview of this paper entitled The Effect of COVID-19 Illness on Pregnant Patients with Rheumatic Disease, Early Reassuring Data by Dr. Lisa Samarantano from Weill Cornell Medicine, New York, USA. And today I'm pleased to be speaking with Dr. Bonnie Bermas on the effect of COVID-19 on pregnant women with rheumatic diseases. And Bonnie, I want to thank you for taking the time to speak to me and to our listeners. So let us begin.
Thank you so much, Dr. Silverman, for inviting me.
Pleasure. So first question, could you briefly describe, for those who don't know, what the COVID-19 Global Rheumatology Alliance is?
Yes, certainly. I think we all have been really amazed about how all sort of medical personnel have come together during this pandemic to go above and beyond. And this was a very unique example. Really, shortly after the pandemic came to light, in March of 2020, a group of providers put together what was called the Global Rheumatology Alliance. And the purpose of this was to collect data on patients who had rheumatic diseases so that we could better understand how COVID-19 was going to impact our patients. It was an extraordinary effort, and I was invited later on, so I was not part of that initial effort at all. But it was an extraordinary effort where they actually got surveys out on websites across the world within 1 week, really amazing. And what they've done is collected data. It's provider entered data on patients or persons with rheumatic diseases who get COVID. Data includes things like their age, their diagnosis, what medications they're on. And this group has, because of that, been able to generate a lot of information that's so important for our patient population. I was fortunate enough to be part of the group that was looking at the subset of patients that have rheumatic diseases who were pregnant and self-reported, or the provider reported that they had contracted COVID-19.
It's very important data. And could you please briefly outline the major findings of the study?
Certainly. As this was self-reported, we obviously could only capture those, or provider reported, we could only capture those reports that entered the database. And so we reported on 39 women who were pregnant who contracted COVID-19. Because early on, I think we were all concerned about what subpopulations of patients were going to be more predisposed to complications. Fortunately, the patients reported appeared to do well. Higher rate of hospitalization, including about 26% of patients were hospitalized who were pregnant versus 6% in the general population. Sorry about that.
That's okay.
6% in the general in the control population. But fortunately, although 2 required supplemental oxygen, there were no deaths amongst this group. And if you even think about hospitalization rates, as we know, when we think about caring for patients who are pregnant, we don't know if that really reflects an actual increased disease burden that necessitated hospitalization, or where there is more concern about pregnant patients, and so they may have been more readily hospitalized. But nonetheless, the data were very reassuring that pregnancy per se was not putting our patients at greater risk for COVID. This sort of echoes what others have found. There's a slight increase amongst pregnant patients in general of being hospitalized and towards the last trimester requiring supplemental respiratory support with intubation. But a lot of the risk factors for that subgroup are the same risk factors we're seeing in the general population, such as non-white race and ethnicities, obesity, advanced maternal age in this particular case, comorbidities, including hypertension and diabetes. Overall, though, the data, not just in this study, but in other groups, has been reassuring.
Okay, I think you almost answered my next question, unless anything you want to add, about updated data that you can reassure us either from you have, and you did address.
So the Global Alliance does not have updated data, but there are other groups who've now reported on this, and the data are very similar. Slight differences in symptomatology. Sometimes there's been reports of more loss of taste and smell amongst pregnant patients. But overall, it's very reassuring that pregnant patients, slightly more hospitalizations, as I said, slightly more intubations, but overall seem to be do okay with COVID, or certainly not significantly worse than the general population. One piece of information that's been very hard to assess is something called vertical transmission. So vertical transmission is if the mother gets COVID, does that get transferred to the developing fetus? And while there have been case reports, the incidence of that appears to be extremely low.
Oh, that's very interesting. I know that your study didn't examine the issue, but what are the recommendations of the COVID-19 Global Rheumatology Alliance regarding vaccination during pregnancy?
So, I think that the Global Alliance hasn't come out per se to make recommendations for vaccination. I think this speaks to a little bit broader issue, which is if pregnant women tend to be excluded from a lot of clinical trials, and in fact are often excluded from vaccination trials. So of the original vaccination trials, that was a criteria for exclusions from the studies. However, there have been groups that have looked at vaccination in pregnant women, and it appears that there's no increased incidence of untoward effects. And in fact, vaccinating pregnant women actually increases, there's a higher titer of neutralizing antibodies than in women who actually contract COVID-19 and develop like natural antibodies. So they make one of the concerns was because of this sort of immunomodulation that happens in pregnancy, is it possible that pregnant women wouldn't mount as good a response with vaccination? And the data that I came across does not suggest that. They mount a very good response. And, if you think about it, we want, just like we want our pregnant women to get influenza vaccines, we want our pregnant women to get vaccinated. In particular, COVID, the coronaviruses tend to impact maternal health more than they do fetal health. So it's really important to get our moms, pregnant women vaccinated to protect them and their health.
I think it's very important. I agree completely. And certainly, vaccinations certainly aren't contraindications during pregnancy for anything that I know of. So it's very important data. And is there anything you think we may have missed that you'd like to add?
This is just a big picture viewpoint. Right. As rheumatologists, the majority of our patients are reproductive age women, or many of our systemic rheumatologic diseases impact reproductive age women. And I think all of us are becoming increasingly aware that we have to be knowledgeable of reproductive health issues in the women we care for, and men as well. And I think that I would say that rheumatology has moved a long way from a couple of decades ago, when patients who had significant rheumatologic disease were sort of often dissuaded from trying to become pregnant, were often just taken off all of their medications. During pregnancy, without recognition that unmitigated disease activity, whether not just in lupus, but in all diseases, actually makes worse pregnancy outcome. So I think the question of vaccination and the question of us studying pregnant women who contract disease is really that we need to be aware and care for pregnant women, just like we care for non-pregnant women, and not shy away so much from indicated medications that are compatible with pregnancy and vaccinations that appear to be compatible with pregnancy. So that's my big picture message. This is a little slice of that, but I think that's sort of my take-home message for everybody.
Right. Sorry about that. No, I think that's great. I think we really have to be aware of all these issues in pregnancy. I think this is something that we tend to ignore at times, for sure. So,
well, I just tell you, there's a group of us in the American College of Rheumatology who've been very interested in this for the past decade. And we had our first study group at the annual meeting, I don't know, 6 years ago. And we were so excited to get 75 attendees. And this year in the virtual meeting, people were locked out. There were only 500, there were 500 people at the study group, and there were people quite upset because they were locked out. And that just reflects the growing body of interest. A lot of younger colleagues are really taking this on, doing research. So we're going to really get increasing information so that we can help our patients make good decisions for themselves when they think about family planning.
yeah, I think, as you point out, certainly rheumatoid arthritis, lupus, a lot of the big diseases certainly occur in women of childbearing age. I mean, it's super important. Well, thank you. And I want to thank you for taking that to speak to me. Is there anything else you want to add before we end this?
No, I want to, except to say thank you so much for having me today.
Okay, well, my pleasure. And to our viewers, please read the full-length article entitled COVID-19 in Pregnant Women with Rheumatic Disease, Data from the COVID-19 Global Rheumatology Alliance by Bermas and colleagues of the COVID-19 Global Rheumatology Alliance, as well as the accompanying editorial entitled The Effect of COVID-19 Illness on Pregnant Patients with Rheumatic Disease, Early Reassuring Data by Dr. Samar. I knew I was going to do that. Samar at
Maritano, he's a good friend.
I know, I just get tongue-tied.
I know, me too, all the time.
I know, at jroom.org. And we'd love to hear your comments on Twitter at jroom or by email, manuscripts@jroom.com. And thank you for joining us, and hope you'll join us next month when I speak to the author of another article of particular interest from the February 2022 edition of the Journal of Rheumatology.